XYZ, XYZ, XYZ.
If you're a med student at UN like me, you'll probably spend 75% of your undergraduate training at KNH. What most people see is really just a huge grey and old hospital packed with hundreds and hundreds of patients and healthcare workers. But at a deeper level, the grey walls and pillars are a museum of Kenyan history, dating back over 120 years ago to the colonial era. This makes KNH a perfect case study for the colonization and subsequent decolonization of healthcare in Kenya. Kenyatta National Hospital, located in Nairobi, Kenya, stands as the largest referral hospital in East and Central Africa, with a remarkable bed capacity of 1,800 and a dedicated staff of over 6,000. It wasn't always called KNH, however. In fact, it had two other names prior to that. In the early days of colonialism, the healthcare landscape in Kenya was marred by segregation and inequality. Europeans were given priority in accessing health services, while Africans and Asians faced significant obstacles to receiving medical care. This discriminatory approach was rooted in the colonial administration's view that Africans and Asians were temporary residents in urban areas, and as such, their social needs were deemed unimportant, and they were supposed to fend for themselves. This policy of selective care exposed Africans moving to Nairobi for wage labor to substantial health risks, as they were denied access to Western healthcare services. This denial, combined with the disruption of traditional lifestyles due to colonization, led to an interference in the traditional health practices that Africans had developed to address prevailing health issues. KNH started out in 1901 as a native civil hospital, which was established to solely provide curative services rather than preventive ones to Africans employed by the colonial government. Located at the intersection of Government Road, which is now Moi Avenue, and Kingsway Avenue, now University Way, this hospital with a bed capacity of 40 beds underscored the administration's neglect of Africans' well-being. As a result, its conditions were far from adequate. It was understaffed and poorly equipped, with leaking roofs, inadequate sanitation, and overall substandard facilities. These conditions characterized the native civil hospital, a reflection of the colonial administration's interest in maintaining a status quo of inequality. The outbreak of World War I exposed the British colonial government's unpreparedness to deal with the influx of people to Nairobi. Given that the only existing 5 hospitals in Nairobi and their staff were barely enough to meet the needs of the population, the British colonial government had to do something to save the lives of the large soldier population that had converged in the capital. Consequently, new temporary hospitals were put up in the town to cater for the medical needs of the soldiers. These included the King's Africa Rifles KAR Military Hospital on Railway Hill off Ngong Road, the British Military Hospital in Kabete, and several others. The war brought Europeans in closer proximity to Africans than before. Through this close but limited interaction, the colonial government was forced to improve healthcare services to Africans to limit the possibility of infection spreading to Europeans. Consequently, the native civil hospital began offering preventive services and extended its provision to Africans who were not directly employed in European plantations or government hospitals. The need for broader healthcare services prompted the idea of improving conditions at the native civil hospital. In 1922, the hospital was relocated to the site that had served as the KAR Military Hospital during the First World War, which is the current location of KMTC and Kenyatta. The old hospital building was converted to the Nairobi General Dispensary, offering outpatient services and referrals to the native civil hospital, but was shut down in the 1940s. During this time, the idea of establishing the Nairobi Group Hospital Scheme, a hospital that would cater to all races in the same area, albeit not under the same roof, was raised. but finding a suitable location proved to be a challenge and the proposal was shelved. The group hospital idea was revived in the late 1930s, with the selected site being right next to the new native civil hospital. The first block, the African wing, of the Nairobi Group Hospital scheme was completed and opened in March 11, 1947. The Asian community also contributed to this vision by funding a 123-bed hospital in this vicinity. In 1952, the Native Civil Hospital and the whole complex of the Nairobi Group Hospital scheme was renamed the King George VI Hospital in honor of the recently deceased British monarch. When King George VI died, his daughter, Queen Elizabeth, aged 25, was in Kenya on a royal tour and was at Treetops Hotel in Nyeri, as is famously remembered. Over the years, King George VI Hospital continued to grow and evolve. During the state of emergency in Kenya, it played a role in treating wounded Mau Mau fighters, reflecting its commitment to providing care to all Kenyans. New facilities were integrated into the hospital, thus expanding the hospital's capabilities. These included infectious disease hospital in 1957 and orthopedic units established at the site of the British Military Hospital in Kabete. After independence, the hospital was renamed Kenyatta National Hospital on April 17, 1964, after Jomo Kenyatta, Kenya's first ever president. KNH became a state corporation in 1987, and fast forward to many years later, KNH now has 50 wards, over 1,800 beds, 22 outpatient clinics, 24 theaters with 16 of them being specialized, accident and emergency department, and over 6,000 staff members. This hospital currently serves three main functions: serving as a national referral hospital, providing services for teaching, where it hosts the University of Nairobi Faculty of Health Sciences, and fostering research through the various institutes domiciled within the compound of Kenyatta. And that is the history of KNH.
XYZ.